Namaste, this is Nutan Manohar. I'm the founder of Me Met Me, a sleep whisperer by profession, an adjunct faculty with the Indian Institute of Management co-recorder on well-being, and a TEDx speaker on aroma phytopsychology, or as we would like to think about it, perfumery and how it impacts well-being. Namaste and welcome to this session where it's not about me but about the panelists who have joined in, two esteemed doctors who are going to be discussing about total health. So on behalf of World Health Day, I invite you to listen in where we can understand what is total health and how can we have tips and techniques to include total health when we think about our well-being. So we have here Dr. Neeraj Nagaich, Senior Consultant at Fortis Escorts Hospital, Jaipur. Earlier, he's worked with SMS Medical College, Indraprastha Apollo Hospital, Delhi, and various other medical practice centers. He's also published over 20 national and international publications in the field of gastroenterology and has even contributed to a couple of chapters in the field. He's a fellow of American College of Gastroenterology. We also have Dr. Praveen Gupta. He's a newborn and pediatric consultant in Manipal Hospital, Ghaziabad, with over 18 years of experience with hospitals like Batra, Max, Kailash, etc. He's an evangelist when it comes to child feeding, behavior, parenting, counseling. So that means that we have here with us few evangelists who really believe in how you can actually lead a healthy and happy life. The very first question I have is to Dr. Neeraj. Dr. Neeraj, within today's context, how do you define health?
Yes. On the outset, I'd like to congratulate all for a healthy future and the World Health Day, which we every year we celebrate on this day today. And it was started in 1948 initially when the World Health Organization gave a theme and it was formed. And every year we move on with a new theme. And as far as the health is concerned, the basic World WHO definition which is given is the basically the presence of complete physical, mental, social well-being, and not merely the absence of a disease or infirmity. So that is the basic definition of the health which comes from WHO. But there are always additions to this. And in 2009, there was a research study done in Lancet, where actually they added a new dimension, how we can adapt to a new threats and new infirmities. That is also one new dimension. So when it comes to total health, I want to add there are more dimensions apart from physical, mental, and social, as we all know that emotional health is also very important. A financial health is also important, and a spiritual health. As we evolve in all these dimensions, the spiritual health is one thing. Well, we are not doing for only us. We go for a higher cause. We go for helping out the society to uplift themselves. So all these dimensions comprise the spectrum of total health, and that is our intention as a health workers to lead the people to live their full potential.
Thank you, Dr. Neeraj. That was very, very insightful to see how the definition had evolved and how we are kind of adding on various dimensions as well. To just highlight, I mean, one of the things that I definitely love to do is, especially when I work with either students or corporates as well, to see is what is the health like. So as WHO in their quality of life questionnaire or the instrument that they use to measure quality of life, very clearly there is about physical health, psychological health, social health, as well as environmental health. But then, as you rightly pointed out, what about our resilience? Always think about, are we becoming resilient to stress and change? Can we sleep deep? A problem that we seem to be having. Can we stay happy and motivated in the morning? Am I ready to take on the challenges that come from my way, or am I running away from it? Of course, we have to look at, what are the body functions going on? How are we doing depending on age and lifestyle stage, etc. So thank you so much for all that input. At this point, to Dr. Praveen, the question is: in the past, health was seen as lack of disease. Is it just lack of disease, or do you see other dimensions to defining health?
Thank you very much, Mithunji, for involving me to such a important seminar. And that is really, really very important topic, because that is a very big misconception that if you ask to anybody, are you okay? Are you healthy? He will say, "Mujhe kya hua? What happened to me? I am fine. I am not taking any medication." But that is this one thing is very important to understand, that if you do not have any disease, it doesn't mean that you are healthy. Health needs a lot more things, as Dr. Neeraj have already said. You must be physically fit. You must be fit in according to your age. As per your age, your fitness should be that much that body should not be the botheration for you. If you are headache, body ache, if you want to do something and you are feeling lethargic, it means your body is not supporting you, but your body is asking something from you. So your body should be that much fit that it should support you rather than asking from you. That should not become the burden for you. That should become an asset for you. So in the same way, our mental health also, mental health should be fit enough. We should be fit to bother what is anxiety, depression. These are not normal things, anxiety, depression. And apart from anxiety, depression, attention seeking, and this identity crisis, feeling to seek appreciation from others. These are not very healthy things. Our mind should be cool and calm and happy and enthusiastic. We should be ready to help other rather than seeking from other. If mind is such a good state, then we will say that our mind is healthy. It is not like that we must have some mental disease, exactly depression or schizophrenia, to say that our mind is unhealthy. In the same way, we should have clarity of life, what we are doing and why we are doing everything. If you ask anybody that why are you doing all the things, why are you doing this job and all other things, they would really not have answer. They would have the only answer that since everybody is doing, so we are also doing. That is not the correct logic. So we should have good clarity of life, and that clarity of life is actually spirituality. Spirituality is very wrongly taken by our society. We think that puja part is spirituality. No, clarity of life is spirituality exactly. Another thing is we should be socially responsive, because if we are not socially responsive, if we are healthy, we feel to be responsive. We feel happy to help others. So that is a sign of this healthiness. So we should be socially responsive for each and everything. We should be helping. We must be joyful. All these things comprises health, just not absence of disease. Although absence of disease is a uh, integral part of to say that we are healthy. And even I would like to say that a seasonal disease of like viral fever should not be considered as unhealthiness. If something happen once or twice in a year, that is not a big issue. If we have depression, we are not feeling well, that is major issue. And at that time, we should consider ourselves that we are not enough healthy. Thanks a lot.
Thank you, doctor. That was so beautifully put. It's absolutely correct that, absence of disease is not health. Health is far bigger than that. At this point, I think I would like to add a few of the insights I got after I fell ill and then started reclaiming my health and happiness. And that's where I started understanding that health is to be able to be more, to be able to do more, but with joy. And that's something that you have also echoed very beautifully. And I think when it comes to health, Maybe we could also start thinking about it in terms of, are you able to effortlessly and joyfully do all your physical, say, living, which is related to your body, your mental living related to all your cognitive functions, all your intelligences, your emotions, etc., as well as social life. Are you able to take care of your day-to-day living, both physically, mentally, as well as socially, effortlessly and with joy? What about agility? If things change, are you able to adapt and be still able to have a bit of joy in your life? And finally, when it comes to it, what about endurance? If you have to do it over and over again, can you do it without a burnout? So possibly if we start looking at it, we start having a more holistic approach to, what is health. So it no longer becomes about whether you have a six-pack abs or whether you look just as healthy as maybe somebody else of your age, but instead it becomes about how well can you lead your life. At this point, Dr. Neeraj, when it comes to India, there are lots of concerning trends when it comes to health. We seem to be having a lot of people, especially youngsters, falling prey to cardiac conditions. When it comes to happiness, we seem to be doing poorly according to UN. When it comes to depression, according to WHO, we seem to be doing very poorly as well. When it comes to various lifestyle disorders like diabetes, blood pressure, about poor nutrition, even though obesity seems to be increasing. There seem to be various concerning trends. Could you actually throw light on it?
Yeah, yeah, very nice. So see, a lot of health development we have done in last many couple of years. There's a significant decrease in the infectious disease, a lot of vaccinations, a lot of therapies coming. But on the same side, lot of increase in the non-communicable diseases or the stress-related lifestyle diseases, which is like becoming more and more evolving in India. Those diseases which used to be in the world, now they are striking India. In a way, obesity is increasing, the hypertension is increasing, diabetes is increasing, and a lot of cancer-related diseases also increasing. So in a way, these diseases are related to the lifestyle as such. And there's a rampant increase in all of them: blood pressure, cardiac diseases, diabetes, obesity, and other mental related changes like anxiety,
Mm.
depression, sleep related disorders, and overall equilibrium, sense of equilibrium, which is, as you told, to function in an optimum way, that is lacking. So simultaneously, this is the real call that now we wake up and as prevention is always better than cure. So these are all diseases which are preventable diseases. By a proper lifestyle, by a proper healthy scheduling and all things, we can cure them before they are emerging, or we can prevent them from coming out. So this is really a concern, and we have to take the call. We as a doctors and the as a society, we have to take the call and educate all of us so that we can prevent these diseases.
Thank you, Dr. Neeraj. I mean, that's absolutely like, right. When it comes to our life, we often forget that, we have a long life to live. Instead of, focusing on maybe abusive food habits, such as eating junk food, instead of maybe, bad habits like smoking, drinking, etc., and also leading a very stressful life, we should actually think about, how to improve that quality of life. How do we make active choices every day so that we can actually lead a very good life even into our 80s, 90s, and hundreds. At this point, Doctor, you kind of had a very interesting topic which is very close to my heart about sleep. So at this point, Dr. Praveen, I would like to ask you, are we neglecting sleep? As a country, are we neglecting sleep? As a doctor, can you tell us a bit more about the role of sleep when it comes to health and happiness?
You have raised a very good question. Role of sleep is really very important. Actually, I would like to say that what you said, are we neglecting sleep? I would like to say we are neglecting ourselves, not only sleep. Actually, we are so much busy of improving our outer environment that we are neglecting our inner environment. And real life is in our inside, not outside. So we must improve our inner environment to live healthy and happy rather than outer environment is okay. I'm not against that. that should be improved, but not at the cost of our inner environment. So what do the sleep does? Sleep is a form of deep rest, and it while we are working, we are doing all the day-to-day activities. What we are doing at that time? We are doing actually lots of stressful activities, lots of random activities, which causing tear and wear in our body, and our hormonal structure in the body and our body physiology becomes in somewhat way disorganized. So what does sleep do? If you are having deep sleep, good sleep, then our body recover at that time. Sleep recovers our body. So not only sleep, I would like to say rest recovers our body. So we need a good sleep, not only sleep. If we even meditate, meditation is a good form of rest. So I would like to say that rash activity will cause tear and wear in our body, and sleep will cause healing from tear and wear and recovery from this day-to-day life tear and wear. So sleep is form of deep rest. So if you do even good joyfully and restfully, or if we do our day-to-day activity joyfully and restfully, so wear and tear will be minimized by this also. And after that, if we give some time to meditate also, then wear and tear will further minimize. And after doing all these things, sleep requirement will decrease, and we will get a deep sleep, good sleep, and this good sleep will recover further our body. So when we will wake up, our body will be totally rejuvenated, refreshed, and we will happy, enthusiastic for life. And daily in the morning when we wake up, we will wake up with a new enthusiasm, with a new refreshment in our life. So that is what is the real role of sleep, and that is very important. Any form of rest is important.
Thank you so much, Dr. Praveen. Actually, in a recent study by Fitbit, it was a global study, it was found that India was the second most sleep deprived country just after Japan. Now, while Japan seems to be doing better in terms of health indices, India seems to be doing pretty bad in various health indices, especially related to lifestyle disorders. So it is true that we are neglecting sleep. We tend to think of sleep as something that can be done away with. But let's understand that even with evolution, where this body was created 50,000, 100,000 years ago, even then, what's it when the body was taught to be put to sleep for 8 hours, so 10 hours, or even 7 to 9 hours of sleep was compulsory for the body, so that the body can recover, rejuvenate. The body is put into something that is made it very vulnerable while they are sleeping. But even then, within evolution, it was understood that this is necessary so that the body can function. You might be able to do without food, but you really can't do without your sleep. So making sure that you do not neglect your sleep is very, very important. So thank you, Dr. Praveen. Dr. Neeraj, as we understand that we are living in a very, very stressed out world, as a health evangelist, as somebody who's championing total health, as a doctor, what is your suggestion, or what is your take on, or what is your advice to a stressed out world?
Yeah, definitely. Very important. As I think this is the duty of all medical persons or other health related persons, that they educate the people that the essence of prevention is better than always a cure. And now, not only the physical health is important, but mental health is also very important, because now science is studying that behind any disease being formed in the body, first it forms in our mind. In a way, stress and the hormonal neural flow that affects the body, particularly in gastro practice, we see irritable bowel syndrome or other many diseases, even IBDs, they are related to the lifestyle stress related changes. So we have to emphasize the public that the physical health definitely is very important. You should maintain an ideal body weight. There should be regular exercise, should be going on the diet, should be healthy, small meals, avoiding carbohydrates, oily, sugary, more fruits, vegetable. But what we can do for mental health is mental health is really more important than physical health, I'll tell you. So as we already discussed too much, there's a good restful sleep is important, number one. And secondly, meditation is one thing which we are lacking. I think it is a new dimension to our health, is reduces the stress. It also reduces the need of the sleep to the body in a way, like it enhances that. Even if somehow sleep get disturbed, though we have to try and maintain good sleep, but meditation can enhance that. So we have a lot of misconception about the meditation, like most of the public feel that is something we can't do, something not needed for a modern world. But a lot of scientific studies have proved that basically it's a complete science in which there are breathing techniques, there are postures, and there are combination of a set of things which we call the different meditative process that really reboost your full body and mind, and the neural and hormonal flow of the body gets to its optimum. So I think the three things which should come from all health persons to the public is maintain a good physical health by regular exercise, maintain a good mental health by doing meditation, avoiding stress, and definitely evolve in a bigger cause rather than as Dr. Praveen told, that rather than help seekers, you should be help providers. So that is the spiritual angle. The spiritual angle comes when you tend to help others rather than seeking help from others. So I think these things are important.
Absolutely, doctor. So very clearly, I think, I mean, even as doctors, as medical practitioners, we need to start looking at mental health, the role of meditation. Often meditation is misunderstood, as doctor mentioned. Many times people think it's a religious practice. No, it is actually a mental health practice to help the mind to rejuvenate, to restore, to kind of get back to a state of balance. And of some of the studies that has been done by Acker and and Kabat, they even suggest that even 2 minutes of meditation throughout in a day across 21 days can have huge impact on your mental health. So it doesn't mean that you have to spend 1 hour. Even couple of minutes can make a big difference. But yes, of course, if you can spend some time on it, you can actually transform your life. So thank you so much, Dr. Neeraj. At this point, the question to Dr. Praveen. I know that you are very, very keen on helping parents become the best version of of parents when it comes to their children. So when as a parent guide, what is the advice that you would have, or what is the suggestions that you would have to give for parents?
Thank you very much. That is a very important question, extremely important, because parenting make the personality of child, and concept of parenting is really need to modify. I would like to say is really in somewhat misguided, probably by media or Western culture, whatsoever you can say, but really misguided. The parents are pushing children to perform rather than they should be pushing children to perform. They should push children to develop themselves. If they have good development, performance will automatically improve. But they are not focused on development. They are focused on performance, and at the cost of their own development, their happiness, their personality, at the cost of all these things. So that is very dangerous thing, and that will lead to lots of stress and depression and all these mental issues in the future. And even you must be seeing even 10-year-old, 15-year-old, 20-year-old kids are very much stressful. They are unhappy. They drug addiction is day to day is increasing because parents do not guide properly. Parents who guide on can guide only what they know. If they don't know the real meaning of lifestyle, then how would they guide the children's? They must know that children should be guided in a way that they should perform all the things keeping their mental health intact. Means they should be able to perform each and everything with nicely with maintaining their happiness and calmliness and enthusiasm rather than taking stress. You can say we work in two ways. Number one, stress motivated work. Number second, happiness motivated work. So they must teach children to and make them practice to work happiness motivated. That is the one of the most important thing that I would like to say to the parents. Second thing, they must understand that if your child even becomes IAS officer, but in the age of 30 or 40 years, he develops some cardiac event, some disease or relationship disharmony, and he spoils his life. What is the benefit of being IAS officer for him? He must be basically happy, calm, and enthusiastic person first. Then he must be then you can push them to any direction. And second thing, every person have some specific potential for what we say ki the person is made for this thing. So parents should allow kids to perform their action according to their choice. This is very important so that when they perform the actions, they perform the day-to-day lifestyle according to their choice, then only you could be able to understand what is his specific potential or what is he is made for, what is what he can do the best. And if he chooses the field, what he can do the best, then hardly performance matter. He will definitely be high performer, and he will be multi-dimensionally, he will be happy and satisfied with his life and will be fulfilled. Thanks a lot.
Thank you, Dr. Praveen. I was just so intensely listening into you. In the past, we didn't, I mean, maybe when we were all growing up, we didn't have so many opportunities and we did not have so many options. Thankfully, children these days have a lot of options and opportunities when it comes to their future. So a lot of stress that parents take in terms of, will my child succeed can be done away with. Instead, you're absolutely right. Children should be taught how to find what makes them happy, what is their purpose, what are their intrinsic motivators, to be able to help them identify that. That is going to become a game changer when it comes to happy India. Likewise, I think a very good point that you said is that children don't really listen, but they learn from what you model. So if you are trying to guide a child to be healthier or happier, as a parent, you have to start first. So that was a very, very interesting point to listen as well. So thank you so much, Dr. Praveen. I mean, recently I happened to hear something from yet another doctor that, people say that obesity runs in the family, but the fact is that nobody runs in the family, and that's why you have obesity. So I think we need to move away from, talking to children. Instead, we start doing with children, and that's going to make a difference. So thank you so much, Dr. Praveen. That was very, very insightful. I think these are very pertinent questions when it comes to World Health Day. So thank you so much, doctors, both of you, for sharing your insights. I believe that these kind of discussions are going to help people understand that it's not the absence of disease that we should aim for, that we should aim for total health. And we shouldn't even be looking at how are people in their 50s or 60s or 90s living in terms of health. We should look at those outliers who seem to be having it all. They seem to be working, they seem to be enjoying life, and that we are also capable of living that way. So thank you so much, Dr. Neeraj Nagaich. Dr. Praveen Gupta. Would love to have your concluding remarks. So Dr. Neeraj.
So at the outset of World Health Day today, I think the crux message which should come to all of us, that at the physical level, we have to keep a good physique, a good body, so that it can support us whenever, whatever we want to do. And at the mental level, the essence should be that we should enjoy life and we have the ability of bounce back. Whenever extreme situation comes, we should be able to bounce back again to normalize that. Very important to strike a balance between your own health, family, and the finances, not inclining towards one side. And we should have a feel good and safe and secure. And as Dr. Praveen said, the most important thing, you should achieve your potential to full extent. I think that is total health.
Thank you, Dr. Neeraj. And Dr. Praveen, any concluding remarks on this World Health Day?
I think we wish all of us to attain total health.
Thank you so much, Dr. Neeraj. I think, yeah, Dr. Praveen, we seem to have lost his feet, but then thank you so much for spending this time. Thank you.
Thanks a lot. Thanks a lot.